Hello, everybody. I am Dr. Sujatha Sankaran. I am the Program Director for the Master of Science in Global Health Sciences program at the University of California at San Francisco, and I am thrilled to tell you all about the program today. We are the first Global Health Sciences MS program in the country, and our Institute of Global Health Sciences at UCSF was established because leaders recognized that the way that we dealt with global health was siloed. There's so many different people involved in global health: academics, policymakers, implementers, and funders, but they just weren't talking to each other. And this really led to a lost opportunity for impact. And things just weren't working as well as they could. So our leaders created IGHS so that people from different disciplines could come together, talk to each other, solve problems with the sole purpose of achieving impact. Mimicking this process, we created our Master of Science program, where a number of students come together from different disciplines, different parts of the globe, and learn how to talk to each other to solve problems. Our philosophy is that together we are stronger. Our master's program is located at the Mission Bay campus of UCSF. Mission Bay, for people who are familiar with the San Francisco, is one of the beautiful sunny parts of San Francisco, and it's an up-and-coming area. There is innovation and biotech happening right here on this campus. There's a new hospital that was built a couple of years ago. There's restaurants. It's just a great, energetic place to be, and this is where, as a master's student, you would spend the bulk of your year. This is Mission Hall, and Mission Hall is a building that our first executive director arranged to be built. It is a building with a very open plan, and the design was really for collaboration to happen. There are global health researchers, academics working in this building. There's students working in this building. There's a lot of opportunity for students to interact with faculty here, and it's a really energetic place to be. All of your classes as a master's student would take place on the first floor. So let's talk a little bit about the program itself. So our program has two tracks. We have a full-time in-person program, and then we have a 2-year 50% time program for students who wish to continue working while they're studying. Our full-time program is usually 3 to 4 days in person at our Mission Bay campus. And our 2-year program allows students to take half of the number of classes each year and continue to work at the same time. Both of our programs have 10 weeks of global health field work, and this is really the jewel of our program. Our curriculum is interdisciplinary, so we're able to learn about the different fields that in global health have to talk to each other. And we have world-renowned faculty. A lot of cutting-edge research in global health is happening in our building at UCSF. We also have the benefit of a low faculty-to-student ratio, and this is a key element of success for our program. We have faculty here who really want to get to know you, and as you probably know, UCSF does not have an undergraduate campus, and so we have a very high faculty-to-student ratio. All of these factors will propel you on your journey during this short and intense year. And really our goal is to strive to train you for global health service and leadership, and prepare you for careers in research, policy, organizational leadership, and program management. In terms of our curriculum, we are split into 4 thematic blocks that you'll learn about in your coursework throughout the year. Unlike many other programs, and certainly most of your undergraduate learning, these courses are designed by our expert faculty specifically for our program. And you are in a small classroom with your peers, focusing specifically on work for this program. You learn so much from collaboration with your peers, and this small learning community is essential to your growth. You start out by learning about foundations of global health. How did global health come into being? Where are we, and how did we get here? We also have a big focus on scientific methodologies for your groundwork. We talk about quantitative methods, qualitative methods, epidemiology, biostatistics, global health economics, and then we go into specific diseases and determinants. We give an overview of both communicable and non-communicable diseases, and we explore the socio-cultural determinants of health. We then move into systems level thinking. We talk about different types of health systems, how they function, and what their pros and cons are. How do they come into being, as well as how does policy impact global health? How do we implement policies? How are they influenced and changed? And how well are our current global health policies working? All of these topics are vital in this era of global health evolution and change. Alongside all of this coursework, you'll be doing a capstone research project, which is the jewel of our program. And this starts the moment that you're admitted into the program. When you're admitted and you accept, in the summer before you actually start classes, we send a capstone interest survey. It's not binding, but it's just an early questionnaire that really allows us to start the process of thinking about what you're interested in. We're going to talk a little bit more about the capstone in detail in further slides, but the general outline is that it's a curated research project that we work with you on very closely throughout the year. As you're working on your capstone, you learn about how to develop research questions, how to defend a proposal. In the spring, you have a qualifying exam, and then you go off and do your research on the ground. Come back, write it up, and then you present at the very end of your training. And that's the close of the year before graduation. Our capstone projects, which is really the highlight of our program, allow you to apply rigorous scholarship to active global health work that's happening in the U.S. and around the world by our world-renowned faculty. The green areas on this map are where at least one student did a project. You can actually check this out on our website, and it's interactive. So how does the process of curating the capstone project work? It's really iterative, but one of the first things we ask you about are, what are the skills you hope to gain? There are a number of different things that you can learn to delve into during your time in your capstone. We can teach you about quantitative methods, and this is a deep dive which would allow you to do surveys. You can think more about qualitative methods, where you go, for example, one student went to the Caribbean and conducted an in-depth interview to learn about people with diabetes. You can learn about statistical analysis. We had a student who worked on a genomics database to look for patterns and determinants of disease. You can work in program implementation. If you want to understand how do you actually do the work on the ground and implement programs, you can go on the ground and see how things are done. You can do a project involving monitoring and evaluation and learn about how the cycle of funding is affected and what are indicator assessments. You can work in policy analysis on a specific topic and see how this plays out, what the barriers and facilitators are to implementation. You can work on a cost effectiveness analysis, and this is really essential for you to present to funders why this work is important and to inform ministries of health on why they should continue to fund different initiatives. You can learn to do a systematic review and do deep dives on specific topics of interest and become a leading expert in the area that you're interested in. We really want to know what you're interested in and create a project that is in that space. We also want to know where you want to go. So we ask you general regions or countries or populations you're interested in working with, and that can be domestic or international. So a quick sample from the hundreds of topic areas that we've studied throughout the years shows that students have done projects in mental health and health literacy and promotion and HIV/AIDS prevention and reproductive health and communicable and non-communicable diseases. Students have done projects on water sanitation and hygiene, in immigrant and refugee health, in women's and children's health, in malaria, on zoonotic diseases, on healthcare systems, and capacity building and system strengthening. It's all over the map on anything global health related and equity related. You bring it to us and we find a project that suits your needs. And these are some quick snapshots of some work that's been done. We've had a student work on HIV and AIDS prevention in Uganda. We had another student work in system strengthening in Uganda. We had a student work in health promotion in Honduras. We had one student who worked in snakebite prevention in Nepal. So really many, many different types of projects. In addition to the coursework and the capstone, you have the opportunity to be immersed into this environment with global health research. There are many, many enrichment opportunities at the Institute of Global Health Sciences. Some examples are grand rounds. We have numerous opportunities for grand rounds. We also have a network of incredible leaders who come and talk to you. We have lectures on cutting-edge topics. This year we've been fortunate to have a seminar series with Dr. Memphela Remfeli, who is a visiting scholar from South Africa and a leader in the freedom movement in South Africa. We've also had events where we've had storytelling from global health faculty around global health topics. We've had numerous other opportunities, and we have many opportunities for professional development, including movie screenings and networking. There are a number of different opportunities if you join our program. In addition, we have a very close support team who helps support you in your journey. You are in the center, and surrounding you are the many faculty members, the IGHS education team, our course assistants who have been through the program, our capstone course team, and our capstone mentors, the number of advisors that we link you to. And with our very low student to faculty ratio, the faculty are really dedicated and want to get to know you, welcome feedback and interaction, and really advise you on this journey. So what is your future in global health? What do our graduates do? The short answer is they do everything. We have students who go into academia, who become research coordinators and analysts. We have students who now are faculty members at Yale, at Johns Hopkins, UCSF, and other international universities. We have leadership roles that our students have gone into, include directors and executives at Centers for Cancer Research, Hepatitis Research, refugee support programs, and laboratories. Some students go into the private sector and they become entrepreneurs. We have executive directors for health-based technologies and startups. We have students who go into management and technical business and product teams. We have scientific researchers and analysts and companies around the Bay Area, consultants for public health and education programs. Some students go into government roles or work for NGOs. We have students who work at funding agencies or are leaders for delivery of vaccines and healthcare, such as in organizations such as Doctors Without Borders, Partners in Health, UNICEF, and the WHO. We have students who are working for the government at the international, state, city, and county levels, and executives and program managers. Really, it runs the gamut. We also have students who are interested in advanced education and training. We have a significant percentage of students who go on to medical school, dental school, nursing school, and we also have students who go on to global health research careers. And you might be wondering if your background is suitable to apply. And in one word, the answer is probably. We actually rely on the diversity of our students to bring our conversations alive. We really try to recruit a wide array of students. We have students who have bachelor's degrees, but we also have students who have master's degrees and PhDs. We have students who are physicians already, who have training in pharmacy and nursing and dentistry. So really, you can study in a number of different areas and be considered for our program. So what is the admissions process? We ask for a personal statement, we ask for a CV, for transcripts and letters of recommendations. If your English is not your first language, you might be asked for TOEFL scores. There is an application fee, but we can waive it if you request that and qualify. And we don't require GRE or MCAT scores, but if you've taken these things and you want to include them, you're welcome to do so. In terms of our deadline, our final deadline is in June, but our priority deadline is in March, and we ask students to apply by March if you want to be considered for a merit scholarship. If you're an international student, we ask you to apply in February as a deadline because we want to make sure you have adequate time for visas and other logistics. So this is the summary of the program, but we would love to hear from you. Please email us at this education email and one of us will get back to you. Please check out our website. We also have info sessions where we will be live on Zoom with you and can answer questions. We hope to hear from you and we really hope that you'll consider our program. Thank you very much.